Hello, everyone, and welcome to today's webinar, the second of our Vulnerable Population series on our 2024 calendar. Today's session is related to human trafficking and implications for brain injury, offered by the National Association of State Head Injury Administrators. Thank you so much for joining us. I'm Maria Crowley with NASHIA, and I'm going to be your moderator for today's session. Closed captioning is available for you by enabling it at the bottom of your viewing window. And if you need any assistance throughout today's webinar, just feel free to send us a chat through Zoom or go directly to Zoom's support site. Questions for our presenter can be added to the Q&A pane or to the chat, and we will address those either as we go or at the end of today's webinar. If you're not familiar with our organization, NASHIA is a nonprofit organization created to assist state government in promoting partnerships and building systems to meet the needs of individuals with brain injury and their families. We would love to have you as a member. We are a membership association, and we offer several different categories and many benefits associated with a membership. Please check out our website for all the available options. And you can also always reach out to Haley Cushion if you want more information there. In addition to all of the numerous training opportunities that we provide, NASHIA offers technical assistance and consulting services. We provide support on a range of topics. Some of these are listed here, but there are many more. General certificates of attendance and social work CEs are available for today's event. Certificates are free for NASHIA members, and social work CEs are at a reduced rate for NASHIA members. It's another benefit of being a member. You'll receive an email tomorrow that has a link with a general feedback form in it. There'll also be a link in that email for your certificates of attendance. If you are a member, feel free to contact me. My email address is here for your promo code for those certificates and social work certificates. All of the information from today's webinar, the evaluation link, the recordings, and the slides will be available later on our website for access. If you choose to view the archived version of this webinar, you'll go to Trainings on Demand and find information on how to obtain all the information that's included. And now I would like to introduce you to today's presenter. As I mentioned, she's going to be speaking about human trafficking, and I'm fascinated to hear what she's going to share with you guys. Teresa Flores is the founder of the SOAP Project, which is the Save Our Adolescents from Prostitution. It's a volunteer organization, and she educates the public on human trafficking regularly across the United States. Her speaking resume is extensive. She has done some TED Talks. She's worked with universities, with law enforcement, medical personnel, the U.S. Attorney General's office. She's testified before the Senate and the House, both the national and the state level, across several states. And she's in a lot of the spaces that your work in brain injury also involves. She is certainly considered an expert in this topic and has been featured on the Today Show with MSNBC, CNN, just to name a few venues for you. She's also a survivor and a licensed social worker who now has a master's degree in education. She's published, and recently there was an award-winning documentary, The Girl Next Door, that was made about her life and her work. So I'm going to stop talking and turn things over to Teresa. Welcome.
Great. Thank you so much. This is wonderful to be able to share with you all information on human trafficking and how it affects the brain and in victims as well. I'm going to share my screen and bear with me while I adjust this. I have a lot to cover here. So So the definition of human trafficking is the recruitment, harboring, or transporting of a person using force, fraud, or coercion. Really, all it means is if you blackmail someone, you manipulate them, or you threaten them into commercial sex or forced labor. We all know what forced labor is. We do have quite a bit of labor trafficking in the United States. Not a lot of it is focused on that, unfortunately. But there is quite a lot of that, especially I would say in your rural areas. But my specialty is domestic minor sex trafficking. Domestic meaning American, minors under 18 who have been sold into into sex acts against their will. If somebody is under the age of 18 and they're involved in any form of commercial sex, by federal definition, that is human trafficking. Which means that teen prostitution, child prostitutes do not exist. There's no such thing. It is automatically human trafficking. And so that changes a lot for people, especially in law enforcement, making arrests, things like that. If a victim is over the age of 18 and has a pimp, they are being trafficked as well. A pimp is also a trafficker, somebody that's forcing them to do something that the trafficker, the pimp, is benefiting financially from. There has to be some sort of financial component to it to make it human trafficking. For those of you who don't know, this is the second leading crime in the United States. Human trafficking is the second leading crime here. And unfortunately, not a lot is being discussed about it. So I'm really happy that we're doing that today. Smuggling is totally different. So when I get questions about the border issues, people can be smuggled here and not trafficked, but they also can then become trafficked because they're much more vulnerable to being trafficked. So it can lead to it, but it is different. We believe the statistics are showing 80% of victims are women and 20% men and boys. But now that we're doing more education with men and boys and trying to get some more resources for them, we're finding that it can possibly be up to 40% men and boys being trafficked as well. So in my talk, I will probably defer to the word as he is a trafficker, although there are female traffickers, and I'll probably refer to it as a she, being the victim, but know that it can be males as well. And then we do think that at least 50% of all victims of trafficking in the United States are children. So a lot of times when people find out that I'm a survivor of human trafficking, they are like, oh, well, what country were you taken to? Or, talk about, oh yeah, I've heard about trafficking, about kidnapping, and it's rarely is it kidnapping situations, all right? Or even being taken out of the country. All human trafficking in the United States, only 3% of victims actually got kidnapped into it. So it is a very small number that get kidnapped. 35 to 40%, I think it's probably 45%, are actually trafficked by a family member. This is called familial trafficking. We see this a lot in the rural areas, and it is happening in all the zip codes as well. So we can't discount that it can be a family member trafficking them. And then around 62%, like especially where my story falls into, got tricked into it or manipulated, generally by somebody that you know. Let's see if I can fast forward this here. Okay, there we go. All right. So very important to know the components, the players in this, all right? So we have the exploiter, the trafficker, generally a male, but more and more females are becoming traffickers as well, we're seeing, especially like in the California area. And so these are people that know that there's a low risk and a high reward. Rarely do we see traffickers getting put away, getting taken to trial. And so it's very low risk. They actually have a higher chance of going to jail for drug trafficking than they do human trafficking, which is very sad. They generally will find a recruiter or a groomer to find the victims. There are, millions of people that are victims out there, victims of crime, victims of abuse, people that are vulnerable and at risk to becoming victims. The interesting part of this is that they don't have to go looking for the customer will come looking for them. The demand for sex for sale in our country is outrageous. We are the biggest consumers of pornography in the world, the United States is. And so those things fuel the fire of human trafficking. And because we don't have sufficient laws, we don't have sufficient resources for survivors, that is why this is the second leading crime. And it's because of the demand for sex for sale. So physically, there are a lot of indicators of somebody being trafficked. And so I have done research with Dr. Laura Letter through the Global Centurion, and we published an article several years ago on the medical and physical and medical and psychological implications of trafficking upon a person. And so these are some of the things that came about. The next few slides here will talk about that research that we did. Generally, if you're working in a healthcare facility, emergency room, we can see a lot of times delayed care, like various burns on top of burns, various stages of bruising on top of each other, bones that have not set because they weren't, taken to the hospital. Generally, victims are not taken to the hospital unless the situation's very dire. So you will see a lot of situations like this, physical or sexual abuse, especially when it's, young children. We see UTIs and bladder infections in young children where that shouldn't be the case. Increase obviously in sexually transmittable diseases, malnourishment. They're not eating 3, good healthy meals a day. If they get one something to eat every day, that's actually a miracle, especially when we're talking about labor trafficking as well. High instances of substance abuse. We've seen this in the last 10 years, where it was not such a big issue of substance abuse, and now it totally is, because it's a way that they are having the victims conform to them and manipulating them. As far as labor trafficking situations, they're not working in very good OSHA protected type environments. So we do see various workplace injuries, exposure to dangerous toxins, poor hygiene, and that's in the case for both sex and labor trafficking. And then we'll go into some of these other ones more extensively here as well from the research. Behaviorally, it is I know it's hard to tell if someone's being trafficked, but these are some really good indicators if somebody has been trafficked, and kind of why, what their actions are, their mindset maybe. We get a lot of questions, I do when I share my story of being a survivor, of like, why didn't you just tell somebody? Why didn't you just, go to the police? And it's not easy at all. What these guys do is like a terrorist activities. That's the brain set that they're hitting on, is terrorism. And it's almost like being in a cult. When you get a survivor out of this, you have to actually deprogram them. And so these are some of the reasons, like you'll see, as what contribute to that. If somebody's in a medical facility, they are still being threatened by these guys, and they're still afraid, all right? And so they might just leave because they're so afraid and refuse getting the help that they need. A lot of times they'll share, you'll say, why are you here? Why are you seeking services? And they might tell a little bit about it. And then the next person, say in triage, they, tell a little bit more. And then when they go back into the room, they might tell a little bit more. And so a lot of times staff will talk, and then they'll think, oh, they must be lying because she told me a different kind of a story. But know that because of brain trauma, that is very typical on victims of trafficking as well. And we'll get into that one more as well. So they might be accompanied to the emergency facility with their trafficker. And remember, that can be a parent as well. So they might not have very good communication skills, might be very nervous or very jumpy, not making eye contact at all, and letting that person who's in charge be there to answer all the questions. And that is not typical for an adult, right? So an adult usually will carry their own documents and answer the questions and fill out the paperwork, right? But in this situation, that doesn't happen. The trafficker is the one that holds their documents, that fills out the paperwork. Sometimes they might be hostile. They might not be the nicest person right now, because of all that trauma that's been done to them. And they're terrified. They're very afraid. So sometimes they can be quite angry, unfortunately. They will want to sleep, and they'll obviously be very hungry as well. The average survivor probably gets 4 hours of sleep a day, if that. So that will then affect their ability to concentrate, answer questions accurately. They might not know where they're at or the time or day. That's another really big indication, of somebody being trafficked. And they all will suffer PTSD and depression, and that's due to the trauma, not just from being trafficked, but they generally will have multiple layers of trauma, for many years. So in our research, what we did is we interviewed 118 survivors, of trafficking, all adults, from all across the country that have been trafficked within the United States at some point in their life. And so we went around in a focus group where they shared their story, where we could verify that they did meet all the qualifications of the definition of human trafficking. And then we gave everybody a paper questionnaire to fill out. So I would say this is the downside to this research, is that it is all self-reporting. So we don't have doctors' records to back up any of this. So just knowing that. So this is one person's questionnaire, and let's go through it. You can see neurological issues. All right, she circled memory problems, insomnia, poor concentration, and nerve damage. We do see quite a lot of neurological damage, because of physical abuse, of being hit in the head, of being kicked in the head, because of excessive drug usage, lack of sleep, things like that. And then just, pure psychological trauma on top of that. She circled quite a lot here on the psychological symptoms here, hostility, nightmares, flashbacks, bipolar, shame, and she starred PTSD here. Everybody that is trafficked will suffer PTSD, without a doubt. Oral health, we'll get into that one later as well, and eating disorders, joint pains. A lot of them will say my body just hurts. And that's from the excessive physical trauma that's done to their bodies, as well as not being able to take care of themselves, not eating nutritiously, things like that. STDs, you can see that she circled several of them on here. That is very typical as well. A trafficker will generally have a per diem or quota that each girl working for him or boy will have to make for him by the end of the night. And this is generally in our country between $800 and $2,000 a night. And so each person that is forced to that they're trafficking will have to make, let's say, $1,000 a night before they can call the trafficker, tell them that they're ready to go back home, or they're beaten severely. And it's not a good situation if they're not making that per diem. So a lot of times the trafficker will make them get condoms, some sort of birth control. But if a victim is being, propositioned by a male and says, hey, I'll give you extra money if I don't have to wear a condom, and that's just that much sooner that she can get out of that situation, most likely she will agree to that, because it's because of getting out of it earlier and getting that per diem, that quota made. But when that situation happens, as you can see, sexually transmitted diseases will go on the rise, as well as pregnancies too. Here, she circled everything under substance abuse. If it's not given to you by the trafficker, it is something that you utilize to numb the pain of going through what you're enduring every day. On here, you can see injuries. She circled every single one. When these men purchase you for a half hour, for an hour, they view this as that they own you, that they can do it with you, with your body, whatever that they want to. And there's a lot of very weird fetishes out there, I'm going to be honest. A lot of them, a lot of this is extremely violent. It is not somebody just coming and sitting down and wanting to talk for a half hour generally. And so you can see, burned with cigarettes, strangled, strangulation is a huge thing, again, leading to neurological issues, right? Kicking, any kind of violence. And on here, and if you can, like my picture's kind of covering it up, but if you can see on the upper right-hand corner here, number of sexual buyers a day, and she wrote 50. This is a little bit more than what I've seen in the past. But generally it's at least 15. So let's say 15 to 50. That could be for oral sex, that could be for full sex, it doesn't matter, that's a buyer. And so can you imagine having to have perform a sex act 50 times a day, 7 days a week, 365 days of the year? There's no sick time, there's no vacation time, all right? And all of the money that you get goes to the trafficker, every single penny, all right? This was interesting. We asked her if she'd ever received any healthcare assistance, and she said she went to Planned Parenthood and a women's health center. And it said, did the healthcare provider know that you were on the street, or sometimes called in the life? And she said it was obvious, but nobody asked her about it. We also then asked her about her pimp. She didn't understand that. A lot of times they refer to their pimp as their boyfriend or a family member. So they're not, a lot of times they don't identify with the words trafficking or being, or like a pimp situation. So that's why the questions that we ask are really important. This young lady used condoms as her birth control method that she got at the store. She was pregnant twice while being trafficked. So she refers to it as her boyfriend, who was actually the trafficker. She does not have custody of any of her children, which is very typical. And on here it does say that she had a forced abortion in her second trimester. And she thinks at least one abortion, but it's not sure. This is also very typical that we see. We have been doing this research, another round of it, with an IRB now, and it is a reproductive research study that we're doing on survivors, that's much more in depth on their reproductive health problems after being trafficked. This was a couple quotes from survivors saying, my bio father would often go with me to the doctor. He would stand right beside me while they were doing a pelvic exam as a teenager. Nobody ever asked what was going on with that situation. That is, to me, deplorable. And the other one was that she had gone to the emergency room multiple times, had many broken bones. Nobody ever assisted her or reached out for her as well. These are the things that we need to change, is the education and awareness of all medical professionals on what the signs are of this. So I'm really glad you're doing this today. So here are some reasons too why they don't speak out, or some signs as well. Again, if somebody's doing all the speaking for the patient, and they're there the entire time, they want to escort them, no matter where they're going. You can, it's always great to separate that person. If you say, let's go get some x-rays, then the other person who came in does not need to go. If you need urine samples, even if you don't need a urine sample, say, hey, let's go into the, let's go get this, and then being able to get them apart from that person if you feel that this is something that's going on. And then if the person's address is actually their work address and where they live at, very big red flag. Or they don't have any standard of address, they don't know their address, or even how they're related to the person that brought them in. These are some really big red flags that need to be addressed seriously. So this is back to our research that we did. This was the some of the results. 91%, just or actually almost 92%, said that they have some sort of neurological issues because of being trafficked. Again, from beatings, from lack of sleep, from drug usage, all sorts of abuse of that. And that then it will affect, obviously, the memory and ability to work, a 9 to 5, things like that. Gastrointestinal issues we see a lot, and that's due to the stress that is from being in a motel, and every half hour somebody walking in, and you don't know if that's going to be a nice person or a real weirdo, and what's going to happen to your body. So gastrointestinal problems are very common as well, and even due to labor trafficking, the places that they're living at. And then we see dental issues. So one of our goals is to start a dental assistance program for survivors. Over 50% have major dental issues. And this could include anything from a full set of dentures needed to just teeth being removed. They're not brushing their teeth twice a day. They're not eating healthy. And they're getting knocked in the head again, their face. Also, drug usage attributes to that as well. We do have a survivor who is in her 60s, and when she was trafficked in her 20s by a motorcycle gang, she escaped, and they ended up finding her and bringing her back to the trafficking situation. And as a punishment for escaping, they removed each one of her top teeth. And so years later, even after being out of that situation, that's a daily reminder of what happened to you. Difficult to find a job, to have good self-esteem, and it's taken $30,000 for her to get a complete new mouth of teeth because of being trafficked. We see this quite a lot in survivors as well. And then violence again, is you can see here 95% of survivors experience some sort of physical violence. And it's just, I don't think people realize when we're talking about forced prostitution, which is human trafficking, how violent it really is. Strangulation is one of the issues. I know forensic nursing have been really passionate about getting passed in legislation strangulation laws, because you can see it here too. Over half of victims are strangled at some point as well. That can be by the trafficker, or it can be by the person buying them for that hour, that half hour. And we see also here, unfortunately, a lot of victims are abused by persons of authority. That can include law enforcement, pastors, parents, teachers, anything like that falls into that category. I thought this was very interesting. People say, well, we just don't see trafficking. We don't see, we don't see the victims around, but you do. We are everywhere, unfortunately. And you can see here that 68% of survivors actually went to the ER. They went to the hospital for care. Over 50% sought out reproductive health care. That could be abortions, that could be STD treatments, things like that. But they do go to the dentist once, a few of them, right? A few of them will go in an ambulance. A few of them will talk to their school nurse, but they're just not getting identified as human trafficking victims. And this is where we need to concentrate on as well. So again, this is the mindset of why someone's just not going to say, oh, hey, I'm a human trafficking victim. Can you please help me? It doesn't work that way. A lot of times it's because they don't know what human trafficking means. They know that they're living in hell. They know that they're being forced to do something they don't want to do, and they don't have any way out of it, but they don't know what's called human trafficking. I mean, if very few of the people and our citizens in our population know it, then certainly they don't know it either. Sometimes they are held in captivity, especially in labor trafficking situations. Sometimes they can't leave. That is generally not the case, but a lot of times they feel like they can't leave. All right. Sometimes they are guarded very closely. My traffickers, even though I lived at home and went to school during the day, they always knew where I was. They were at my school, they would come into my work, they would always know right where I was at. And if my parents were around, they always knew. These traffickers use threats of violence, if not even violence themselves. They don't even have to actually hit you. They use plenty of other tactics themselves, like fear, threats to hurt loved ones. A lot of times survivors will blame themselves, like, oh, I shouldn't have gotten in that car, or I shouldn't have fallen for this. And so they'll blame themselves. And then especially if you're trafficked from a young child and familiar, you're going to think that this is normal. You know in your heart that it's not, but you start to think, well, this must happen to everybody. That everybody's uncle or father must do this too. And so a lot of times they won't identify as a trafficked victim, or they'll even normalize it. Here's some more reasons why they might not tell you or reveal that they're being trafficked. Debt bondage or bondage to the trafficker, the emotional bondage is very common as well. That is called Stockholm syndrome. And it's where they are attached emotionally to the trafficker. Again, think of it as domestic violence, of molestation, of familial trafficking. They're bonded to that family member and told not to tell, secrets need to stay in the family, things like that. A lot of times too, they just don't have the resources. They don't know where to go, what to do, and they feel really hopeless. There's not a lot of options out there. So, unfortunately, 90% of all prostitution arrests are of the female, and yet it is illegal to buy somebody or sell somebody for sex. And so this has caused a huge problem in our country. People have a mindset of what prostitution is, but almost all the time it is forced upon a person. I can tell you, nobody would wants to do this by choice. Of course, we have a few people that we call sex workers or escorts. That's very high end, and it's very small percentage. And I mean like under 8% of all prostitution that's happening out there is actually done by choice. But a lot of the sex workers who say they do it by choice will let you know also that they were victimized as children in some way as well, which makes a lot of sense. So we think of prostitution as a choice that people make in our country. It's something funny and cute, and unfortunately, none of those things are true. We've all seen this woman on the right. If you're like live in Detroit or you're in a big city, or we've seen this before. And her sign says, "Tired of prostitution, need money, please help." I imagine what happened to her is she was probably victimized as a child, molested. 83% of trafficking victims were actually molested prior to being trafficked. And so she probably met an older guy who just told her everything that she ever wanted to hear, said, "Come on, run away with me. I love you. I'm going to take care of you." And her options were pretty slim. So she said, okay. And she had fallen in love with him. And so he gets her out of there, probably changes her name, takes her to a new city, doesn't let her contact any family members, and says, okay, now you owe me. Now you have to get out there and you have to work for me. He beats her, he gets her addicted to drugs. The average person can last 7 years in this life before they end up either dead of overdose, suicide, or murder from the John or the pimp. And so we see her now. She is not within this trafficking situation, but her outlook on life looks very slim. Probably addicted to drugs, probably doesn't have a driver's license, didn't get to go to driver's ed, right? Probably addicted to, well, I said addicted to drugs, probably doesn't have a social security card, never opened up a bank account, probably doesn't have a regular address, never worked a daytime job, ran away at home at 16, and has nothing to show for an application to even try and get a job. So her situation looks very, very bleak. And so this is really the reality of how human trafficking looks. We treat her as a victim. She's the one arrested, not the person trying to buy her. And then this is another part of what the reality of human trafficking looks like in the United States. The girl here in the upper left-hand corner, her name is Grace. She's 15 there. And unfortunately, all of these are pictures of Grace. From the time that she was 15 here until the last photo on the lower right was taken, where she is just 17 years old, and she died shortly after that photo was taken. These are all actually mug shots of every time Grace was arrested for prostitution. Unfortunately, we didn't help her. We didn't save her. And that is what my mission is to save more Graces out there from this happening to them. We failed her. We didn't ask her, hey, what's going on? Can I help you? People assumed that she was a bad kid or that she was doing this to herself. And yet you can see somebody is doing this to her, right? You can see the physical violence that she's going through. You can see the drug usage, the lack of hygiene, right? Probably hasn't eaten or showered in a while. And just really the sheer desperation on her face. Like there's no hope left. This is what human trafficking looks like. You can imagine the neurological issues that she's faced with. You can just see it. You can just see it on her. And had she lived, she would have lived a life of many challenges for the rest of her life. So for myself, I was a bit luckier than that. I grew up with a mom and a dad, and they didn't beat me. I wasn't molested. I have 3 younger brothers. I was the oldest. And I grew up in a really loving Irish Catholic family. And we were pretty well off. I can't complain at all. But the one thing that made me vulnerable is that we moved every 2 years because of my dad's job. So he would get promoted and transferred and we would move again. So I was always the new kid. I was always trying to fit in, trying to have people like me. And I would say I had low self-esteem as well because of that. And I didn't also have a support system. So I didn't have family members, people that knew me since I was young to notice any change, any difference. I didn't have a support system of people that I could go to say, hey, I need some help. And those are the 2 factors that made me vulnerable, was the lack of support system, and then the moving around a lot and always being new. So during my middle of my 9th grade of high school, we moved again. And we moved outside of Detroit, Michigan to a very upper middle class neighborhood called Birmingham. And I got targeted by a group that were in an underground crime ring and that were attended my school, were older guys, but they were a part of a much bigger network. I developed a crush on one guy because he purposely was always around, always kind, always compliments, everything that I wanted to hear. And one day after school, he asked me if I wanted a ride home from school. And I thought, this is great. It's not a date because I wasn't allowed to date yet. I was just 15 years old. And I thought, this is great. He's going to take me home. He likes me. So I said yes. And unfortunately, he didn't take me home. He turned the opposite way out of the parking lot and took me to his house, offered, me to come in. And he's like, I just have to grab something. But I said, no, I was a good girl. I was a virgin. And, but unfortunately, after all of these months of compliments, and he knew he had me in his fist. And he said, I just have to, grab something fast. Just come on in. It's okay. And I trusted him. And I went in, and unfortunately, I got drugged. He had given me a soda, and that was laced with drugs, and I got raped that day. When I went home that afternoon, I made another big mistake, and I didn't tell my parents. I decided that I was just going to keep this to myself. I felt a lot of shame and guilt that I let that happen. And I thought my parents would be angry at me because of our religion. Yeah, it was pretty much demanded that I be a virgin when I got married. It was very important. And so I didn't want anybody to know any differently. So I kept it to myself. And then it got worse because several days later back at school, he came up to me with an envelope that was full of photos, and they looked nothing like what had really happened. He said, "We are going to show these to your father at work, show these to his boss at work, put them around school, show the priest at church." They knew exactly how to get me. They knew exactly what ways I was vulnerable. And so I agreed to do whatever they said to get those photos back. But I didn't really even then know like what my life would be like. I thought it was going to be like doing their homework or, laundry, wash their car, whatever. I did not know that I was going to be forced to service men, night after night, have to sneak out of my house to do this and to earn back the photos. So it was a very long 2 years of living a double life, of nobody knowing what was going on with me in the middle of the night. I would sneak back home and go to sleep the next day and then get up for school the next day. There was lots of red flags. I was kicked in the head. I was um, I was hurt, but not hurt enough that anybody would notice. And it was mostly hurts on the inside, and that psychological trauma that you're enduring every day, every moment, not knowing if they're going to call you into service or not. So it was a very hard life to live with nobody knowing, and nobody saw the signs. Nobody recognized, trafficking back then. And at least they didn't even notice somebody that was going through severe trauma because I lived in a nice neighborhood. And because nobody would have thought something like that was happening, to a kid like me. And I wasn't talking, I wasn't telling anybody because the threats, they threatened to kill my brothers. They followed us everywhere. And so I was doing my best to keep my family safe, and to earn back those photos, while trying to keep myself alive. The thing that saved me was that I actually was kidnapped one night and left for dead in a motel in Detroit. And the next morning, I stumbled into this diner, and I had no clothes. I had pajamas on, no shoes, no money, no identification, and no idea where I was. And the person in my life that saved me was the least likely person. It was a waitress who noticed a kid in trouble and called the police. My family then got transferred 1,000 miles away a few months later, where I was able to escape without anybody knowing. And that is actually how I was able to get out of it. I'm very lucky. Most don't escape this, not at all. Most will die in it. This is a picture of a young girl that I found on backpage.com before the Columbus Marathon. She was being advertised on the escort section for $150 an hour, and it said she was 22 years old. I beg to differ with that. I would like to know who took these pictures of her. People think that she took them herself. She posted herself on there, and I guarantee you she did not. Somebody is over her doing this. And then I found her a year later. It said she was 23 now. You can tell she's probably got some drug usage going on. Again, who took those pictures, right? But people in America think that she's advertising it, she's doing this, and that is not the case. I found these two young girls, babies really, on Backpage as well for sale. under the escort section. They look to be about 12 to 15 years old. And this is what the situation is in our country. So I do want to leave it up here for we've got about 15 minutes that we can take some questions. These are these are the two books that are available now. One is a student's guide to labor and sex trafficking. It's a great overview of trafficking internationally and locally. And then this one is my full story, and then kind of how I healed from it as well. So, I think we can do some questions.
Teresa, that is impactful. I, am not sure where to start with that. I applaud you for sharing, all of the information you shared, but particularly your personal perspective from that. Unimaginable, truly unimaginable. We do have a few questions, and I am curious about a few things myself, but I'm going to start with some of the questions from others.
Mhm.
One of those is something I was kind of curious about myself. The posters for trafficking prevention, that are in bathrooms and in airports
Mhm.
and other spots. Have there been some projects or research done on, does that help?
Mhm. I
Are
think it
there,
helps with awareness. I don't know necessarily if, when I was trafficked, if I saw a sign like that, that I'd be like, oh, hey, let me call, because a lot of times I are using the word trafficking and people aren't recognizing that word, right? What it really means. I think it's a great awareness for the general public that trafficking is happening around us. Maybe I should be aware. So it's good awareness, and I'm sure that some people do see it and call, but I believe that it has to be the person next to you. It has to be somebody within your village, that is gonna be how you're gonna get out of it.
mhm. Interesting suggestion, potentially. This particular person wanted to know, are there any projects where there might be some actual phones provided inside those places that somebody who is being assaulted, could use to call in?
Yeah. Huh, I never thought of that. I don't know how they would do that, but that is very interesting. Yeah. Yeah.
Definitely.
They generally do have phones, just so you know, like maybe one or two or calling cards, which then surprises people because they're like, well, why don't they just call the police? Well, again, because of the psychological trauma, it's not that easy to do. And so when they do make that phone call, it like somebody needs to respond immediately because that's it.
Um, Curious about how the response goes on the other end.
Mhm.
I'm thinking about how to connect, with our brain injury community. Are there some things that we could do, to help with that piece or with other
Mhm.
pieces?
Um, Say that again. What was the
Well, I'll come back
I
to
was
that.
reading the questions and I
No,
like, what?
no, no. Um,
Oh,
have there been, this one came from Chelsea. Have there been any reported upticks in trafficking with sites like
oh,
fans only
yeah.
fans?
Sure, yeah, there have been, we get reports on that as well. So, I mean, it's commercial sex, right, is what they're offering, and which is illegal in our country. And so, because there's such a addiction of sex in this country too, there's going to be horrific situations that come out of that. So, yeah, more education needs to be done to high school students and college students on the dangers of that.
Yeah, as Chelsea states, it seems like, what's happening, with all of those sites and with
Hmm.
social media is just a breeding ground for more
Yeah.
exploitation.
That's the number one way people are getting trafficked, our kids, is through social media.
Several people want to say thank you for your openness and sharing your story.
Mm.
How are schools and hospitals handling this? Are there any particular efforts that are going on in those spaces?
Yeah, I mean, they're offering, educational webinars like this. I do that quite often. But it needs to be done on a massive scale. every hospital and school really needs to have a protocol in place that involves social workers, the janitor, your triage nurses, everybody to come together to say, hey, I think we have a case. What do we do? What will we do when we do see it, right? So I encourage every medical facility, not just hospital, but to have some sort of protocol that they come up with, instead of it being like, oh my gosh, we have somebody that's been trafficked and now what do we do? So it needs to get out there to every single, and anybody in Ohio, where I'm from, anybody with a medical license or like a social work license or teachers has to be trained in human trafficking. And so I think every state needs to have that.
Definitely. I see someone put in the Q&A that they work with students with disabilities and transition programs. Most of these students have intellectual disabilities, but some are nonverbal. If I suspect they're being trafficked, what could I do anonymously, considering they're 18 to 21?
There's nothing you can do. Unfortunately, when they're an adult, they have to be the one to call. If they are nonverbal and you do suspect it too, I think you could make a report to the adults section. What is it? I'm spacing on the name right now. Like you have your children's services, there's adult services
Oh,
or abuse of adults. So there, I would definitely make a report to them. But it is difficulty. We do see quite a lot of disability of survivors that are disabled, physically and and educationally as well, due to the violence, due to the drug usage, things like that. So, but yeah, I guess reporting it to like adult services would be a good start.
there's probably a lot of work that we need to be doing about outreach and education, on what you're talking about specifically, how that overlays with people with disabilities and brain injury for sure. I see that in several of these questions.
Yeah, I like the one on the concussion awareness. So I generally will say that athletes have nothing on traffic survivors when it comes to concussions. And there's so much education being, done on concussions, right? And awareness for athletes and stuff, but human trafficking victims all experience multiple concussions. So, yeah.
And we know in the brain injury space,
Mhm.
children who have been exposed to adverse childhood
ACEs.
things,
Yep.
are more vulnerable to brain injury,
Correct.
later in life.
Right.
Just
And I mean, all survivors have, even myself, who you wouldn't think I'd have a lot of ACEs, I do. And so I had said to somebody, oh, I only have 4 on my ACEs. They're like, Teresa, you're not supposed to have any. And it's like, oh. So yeah, doing a simple ACEs quiz actually is a good indicator as well.
what helped you to heal?
Gosh, my faith is really the one thing that I leaned on heavily because I couldn't find the counseling that would even know what I was talking about. And I didn't have the words like I do now for many, many years. So really my faith, I've read every self-help book in Barnes and Noble, journaling. So that was and then finding my mission, right? This is my mission, my what I'm supposed to do in life. So that has helped as well. But it's every day it's a different, you have to work on it every single day. It's no survivor will be healed. It's how they handle their healing journey.
Right. Just so many questions in here. I,
Yeah.
I see one about countries where prostitution has been decriminalized. Is there a decrease? Do we know?
Yeah, so I don't like to use the word decriminalized on that. When we say prostitution decriminalized, you have to be careful. What Netherlands has done and some of the other countries is where they have stated if a woman wants or a person wants to sell their body, that's their body, they're able to do that. They're not going to prosecute you or arrest you. But if somebody is trying to buy you, then that's illegal. So what it has done is it has criminalized the purchasing of sex and decriminalize the buy, or sorry, decriminalize the selling, but criminalize the buying of it. Which then reduces demand for sex. Because if I'm going to get in trouble for buying somebody for sex, then I'm not going to, it's going to deter me. So it has actually worked very, very well. It's called the equality model or the Nordic model. And that is actually what works the best and is the only thing that will stop human trafficking, is that doing it that way.
Interesting, because the next question I was going to ask, are there any current bills or laws or initiatives being worked on for harsher prosecution?
Yes, there's there's more for not so many for harsher prosecution, but more bills I'm seeing that are coming to help survivors. So we work with a lot of survivors. We do wellness weekends, we do retreats that are completely free for male and female survivors of trafficking. And they have a lot of debt because of the trafficker, medical problems, as you can imagine, medical bills. And so there's a lot of legislation out there to help get their records expunged from when they were trafficked, to help them, get debt out of their name. So there's more survivor type legislation I'm seeing currently.
Wow. And again, there's another item in the chat I just want to reference, because I wonder if this is, true, not true. I wonder if this is the case in other places as well, about people not giving credibility to men taken
Yeah.
advantage of. That's tragic.
Yeah, it really is. There's very, very little services out there for male survivors. A lot of times we're going to see this. We just did a conference last year on males trafficking, and hopefully we'll have another one. But we see with the males, it's a lot more in the LGBTQ community than it is the females. A lot of times they're identifying as gay and then getting kicked out of their home, becoming homeless. And then much more vulnerable to being trafficked. So it seems to be a pattern, not always that way. A lot of the males survivors we've worked with have been sexually abused and molested by family members as well, and then that has led on to being trafficked. So it is a huge problem that we haven't even begun to look into fully.
Right. I wish we could talk for another half an hour. I know we don't have that kind of time, but I do want to come back around to just talking kind of with some last comments about how our brain injury community can help support your work. I know when you and I were talking, you mentioned that there were some new chapters being initiated across states. How can we better connect the work that you're doing with the work that they're doing? And I'm thinking also about, screening for brain injury, because
Right.
it seems very clear that this is a space where there's a high co-occurrence.
Yeah, it is. So depending on where they live, you can go to our website at soapproject.org. I put it in the chat. And you can see under chapters where we have local chapters going out to hotels and motels regularly to help find missing kids that are being trafficked, and just to give hotels and motels where most of this is happening at information. So people can volunteer that way. We have a volunteer form on there. If they want to buy a case of makeup remover wipes and have their friends label them and donate them back to us to use for, like, our next big one is New Orleans for the Super Bowl, right? That's 200 hotels. There's gonna be a lot of trafficking there. So we also have lots of other ways people can, I love speaking. I love doing this. So if you have a group of people that you think should hear what I have to say, working with us that way. We need airline miles, hotel things donated to help survivors. But yeah, there's a lot that people can do. And it's nationwide. So no matter where you live, we can use your help.
Outstanding.
Yeah.
I just appreciate you so much sharing the information that you're sharing, and I feel like you're going to be hearing from a lot of our
Good.
attendees about future collaborations that they can do. Thank you
Great.
so, so much.
You're welcome. I also put the names of my books in the chat too. So somebody had asked. If you just Google my name on Amazon, they will come up. But I did put those in the chat as well.
Great, great. Thank you. And we'll have the slides archived for you later on. And I know Teresa has that information in there as well as, her website. We hope that this information was beneficial to you today, and we would love for you to join some of our other training events.